Good morning, everyone. This is Lynn Schrader. Happy Friday. I just apologize for a little bit of the delay there. I was just loading some handout documents in your panel there, so you'll be able to take those down and save them onto your desktop to look at them early when we get done on the call. So, wow, we have a lot of stuff today, and sometimes the visual I have of this is holding a fire hose up to our mouths. So you're going to see, we're going to touch on all the things we usually do, but there's a lot of buzz, in particular right around now happening in Washington, D.C., and we'll talk through that a little bit later about why. But we'll touch all of these markets, and again, remind you to type in your questions as we go, and I'll grab those at the end. All right, so make sure I'm showing my screen to everybody and that you can hear me okay. I'm going to trust we're going forward and everything's good. So we start with the individual market, and this is just some interesting numbers here about what happened with Medica in this last open enrollment period. As we know, they're still the only insurer selling in Iowa. As we also know, Wellmark has said they do plan to re-enter the individual ACA market in January of 2019, so more to come on that. But check this out, about 46,500 Iowans purchased health insurance for 2018 through Medica, the only choice, and that's down from about 72,000 last year. So we also know that about 41,700, so really close to 42,000 of those clients were receiving subsidies. So when we start talking about throughout this webinar today about the what if could happen with the new Wellmark Farm Bureau deal and some of the concerns about that, I want you to keep these numbers in mind. And again, I share this with you guys so that when you're out talking to your clients or talking to folks at the coffee shop, you have a rebuttal or a comeback to some of their comments around what they think about what is happening with health insurance in Iowa and the premiums and possible solutions. So just check that out. So the folks that are getting a subsidy with Medica, many of them, they're not going to leave to go take an underwritten product, in my opinion, right? So hold that thought there, and so we'll stay tuned to see what Wellmark does, but hopefully that's what'll happen. So let's move right in. That was the only thing I had for the individual market, really, since it's all over and done with for now. But moving on into what's happening in Iowa, and the Senate did pass on Wednesday, and it was awesome because there was a bunch of us from NAIFA that were down at the state capitol, and we got to watch them debate some bills. We weren't there to see this. I think we had left by then, but they went ahead and passed what I'll call the Farm Bureau Wellmark bill, and that is now heading to the House. We think it'll look just like it came out of the Senate. The House will take that bill up. And we did there's been some other conversations. This would not be, of course, part of the legislation, but that we do understand two components. Farm Bureau does plan to pay commissions, and they plan to pay more than Medica's $10 per contract per month. And the second thing we know is that they will use the independent agents. They've said that. Now, we don't see that anywhere yet. And I just saw a question come in, and how did the numbers go for Medica from 17 to 18, assuming they still increase their book? Yeah, I mean, I don't know what Medica's numbers were in how many they enrolled, but they certainly didn't have 46,000. So they might have been closer to 10,000, but they definitely obviously picked up all that Aetna and Wellmark risk. So back to this bill, though, we know those two things. And so people are saying, well, I'm against it, or I'm for it, or what do you think, Lynn, or what do you think, NAIFA, or what do you think, NAHU? And part of me says, hey, it's yet to be determined, but it's all going to come down to these two things. They make the plan available to independent agents, but they also have to pay commission. So I'm hoping that once this gets passed, and it looks like it's going to sail through, and it passes through the House, and becomes law, that there'll be a conversation that will happen between Wellmark's distribution channel, that's us, and Farm Bureau. So, okay. So the other piece of legislation that is being talked about right now is this Health Insurance Association. And we just saw that the Senate on Monday approved the association health plan. So really what this does, now look at this now. And this is why I just was saying, you know, the Farm Bureau Wellmark thing is really targeting individual families. That's, you know, that's the bread and butter, right, of Farm Bureau's market, is the individuals, in particular farmers. And so concerned that some of those folks weren't able to write a group of one due to whatever reason, right, the way they structured their business, et cetera. So then that's, the Farm Bureau Wellmark thing is kind of targeting the individual market. But then we look over to this plan, which is around health insurance associations, and this is really targeting small businesses. Now you might say, well, wait a minute, Lynn, we wrote all those small businesses, right? They're all taken care of already. Well, I think there's still some small businesses out there that aren't offering benefits, or there's small businesses that aren't farmers, that don't belong to Farm Bureau, so that wouldn't work for them, but this might work for them. So they might be a member of an association, and this one does, just like the Farm Bureau Wellmark deal, would be going through medical underwriting. It'd be more of a self-funded arrangement. So when you're self-funded, you don't have to meet the Affordable Care Act guidelines. So here you can see at the bottom here, it says, but critics are concerned the bill would help insurers siphon off the young and healthy workers out of the general risk pool, driving up the costs for all those left behind that couldn't underwrite. I just, you know, part of me says, look, we need options. So why wouldn't we try something? So it'll be interesting to see how this comes down. And so the nature of that could be true, that pulls out the young and the healthy, but how big will that pool get? And we'll have to see, and maybe over time it would do that. So I think we have history, right, that shows that's what happens. But maybe there's some things that we can do, I say our regulators can do, to make sure that there's some kind of protections in there. So more to come on that one, but that's a good one. And you guys, by the way, if you ever wanted to drill down any deeper, you just Google Iowa Senate File 2182, and you'll be taken right to the page that'll take you to watching any kind of legislation that's going on. I have to laugh because seriously, we were sitting there in the Senate. Now we're at the Iowa Capitol, and they were debating a bill to paint posts that are be 3 foot in the ground outside the city limits, paint them purple to designate no trespassing. So think about all of you that live out in the country, and you might have people that come onto your property and they're trespassing. So how do you mark your territory? Universally, they literally were debating a bill that purple is the color to paint the sign or the posts to designate no trespassing. And that did pass in the Senate while we were sitting there. So anyway, interesting stuff goes on down at our Capitol. And if you ever care to get involved in that, please reach out to me and let me know, because these opportunities we go down there, I think it's awesome. So, okay. So as I said, NAIFA was at the state capitol on Wednesday, and you need to know that both NAIFA and NAHU are fighting for us, for our livelihood. So once again, I got to go down there. We had meetings with the Speaker of the House, Linda Upmeyer. I know we've got agents. In fact, Tanya, we talked. We've got other of you agents that would either be in meetings with your representatives, and I can't encourage you more than to make sure you stay connected to these at least once a month calls. I've got some a talking point sheet that you could share with your representatives. Say, this is what we know is going on in Washington, and then some of that does defer to the states, and that's where they get involved in. So one of those handouts you'll see are some talking points I'll get to in just a second. But when we can get their ear, they know NAIFA and NAHU very well. And this is so important that they know us, because they come to us to go, what do you guys think about this? And we can give them our opinion. So that was terrific. That was on Wednesday this week. So here's another one that just got popped up. And this wasn't on anybody's radar screen that I know of until we just stumbled on it this week. So again, another House file. So when it says that, of course, you know, it's coming out of the House versus out of the Senate. And so this is an agreement between individuals and healthcare professionals, and they're calling this direct care. I've also heard it called concierge service. And I remember Larry, one of our agents, Lynn, there's a concierge doctor over in West Des Moines, and this had to be at least 2 years ago, and said, hey, can we get Wellmark to not build in primary care services inside their plans, so that if people want to, they can like carve that out and then go to this provider that would just charge you like a membership fee for the year for you and your whole family. So when you need your primary care, you just come into my office and there's no charge, because it's like you're paying a membership fee, right? So that's what this legislation is. So it's not insurance, won't be subject to the authority of the commissioner. I've got copies of these 3 bills I just talked about here with me. So if you have any further questions on these, please let me know, or if you have trouble trying to find them online. But this is very interesting. See, this is where I get excited about new innovative ideas to help drive down costs, and providers are thinking of them too. Like, if I don't have to deal with billing, right, I could save me a whole person, for example, in my office that does nothing but billing for insurance companies. So I want to get back to providing care. That's what the provider's saying, right? Again, it's just it would be just your primary care type of, physician. It's not going to be any specialty kind of thing. So interesting. We'll keep an eye on that for you. So here was the health underwriters visit in DC, and this was so amazing. This is the talking points I have attached that you might find interesting to say, I want to print that out, and I do want to show my local representatives, here's what we're doing in Washington to help move this thing. And as I mentioned, there are a couple things that say if Washington takes action, it's going to allow the states to take action. And I'll point out a few of those before we're done today. But take a look at the talking points sheet that I've attached. We had 10 folks from Iowa go down to Washington, and we met with all 6 of our legislators. So we kind of divide and conquer. And it's really cool because we even gave our federal legislators a customized talking points sheet. And if you want yours, let me know. I can email that to you. If you think you're going to be seeing them and you don't have a copy of this, it literally would say Representative Steve King. And then it would show, thank you for your support of this particular bill. Most of them supported the bill to remove the health insurance tax, right, the HIT, remove that in 2019, and also push out the Cadillac tax until 2022. It had been just out to 2020. So that did get put through in December. And so we thank them for their support of that, which is super cool that each of these little talking point sheets, like the general one, but then we customized it for each of the legislators. We got to tour the Capitol. It was so cool. We were there the day before Billy Graham was going to be laid in state, right? And so, not very many people get to do that. And so I was taking some pictures, and we didn't go in the area where he would actually be lying, but we saw into that area. So it was just really cool. So if this gets you excited, can you tell I'm excited? But if it gets you excited as I talk about this, please let me know. I can help guide you. We can do it ahead of time so we make sure we get hotel room and keep costs down. But the next visit out to Washington, D.C., February 25 through 27, 2019, get it on your calendar, and then we can talk more later. Okay. So here's what's going on then in Washington. And I'm going to give you guys just some of this. You're going to go, oh, Lynn, why do you tell us this? Because some of this, it's the intention of what's happening. It's what the administration, the direction they're going. And this just is so important because when it comes down and we actually get something, we are expecting it. We know what's coming. So get this. This is, and this, you guys, this whole thing about the Trump administration stabilizing the ACA, what does that say when they do something to stabilize it? They're not ripping it out. And they ran on him, and I mean, not only the president, but several other politicians ran on repeal and replace. So a lot of them can't get behind any kind of stabilization. But boy, we've been working hard to try to, our associations, right, to try to figure out how we can bring some stabilization. Real people are being impacted by these high premiums. So it looks like if they can look at this first one, include language allowing payers to charge higher premiums to older people. What does that mean? You guys, that's that rating ratio. Right now we're stuck in the 1-to-3. It used to be 1-to-5. So you could charge a 21-year-old one rate, and then now we can only charge 3 times that for a 64. Well, we want that going to 1-to-5. So does it mean allowing payers to charge higher premiums to older people? Yes, but it also means being able to reduce premiums for younger people. Those are the ones we need in, right? Expanding the use of health savings accounts. We've been hearing about this, but that means that if more people get on board with health savings accounts, they're putting money tax-free into an account. Okay, that reduces taxes, right? But puts people more in charge, drives this consumerism that I'm kind of on this consumerism bandwagon lately. Here's the one about permitting renewal of short-term plans that don't meet ACA guidelines. Hey, it's okay. So these short-term plans, going from 90 days to 364 days, that's a good thing. Some people just need something to get them through that next job or that student before they finally come off mom and dad's plan until they get full-time work. And then last but not least, look at that last one. The document does not include support for a reinsurance program. We're still waiting on that one, but it backs the funding of cost share reduction plans. You guys, these were the two things that Wellmark said they need to have done in order for them to get back in the ACA market. So we're holding out hope for that reinsurance program. I'll touch on that, I think, later, because there's a bill, I think, that's pending with that. But see, all of this, what they're trying to do is get this into probably the budget, right, that's due March 23rd. So they're looking at other things that they can stick into that budget plan that will keep the government running. They can also insert some other things in this, just like they did back in December. So we'll stay tuned and keep watching there. But this is the exciting stuff. This just happening on March 6th. So I'm trying to pull everything I can that's happening between our last call and today. All right, so here's something else. So if, in fact, this could drive transparency, check it out. Well, consumers with a greater access to their medical data, and probably not transparency so much, but actually it does impact that, because I want access to my health records, especially if we're going to go into a world where we've got short-term plans, or we've got the Farm Bureau Wellmark plan, or we've got an association plan, and they're going to underwrite me. I want to be able to get access to my medical records. Right? If that's how somebody's making a decision on me. Remember back in the olden days where we never really knew how an underwriter made a decision, and it was really hard to get our records. So this changes that. And look at this. It's the administration driving this down to CMS and HHS. And look at that quote there by the HHS secretary. Patients ought to have control of their records in a useful format, period. When they arrive at a new provider, they should have a way of bringing their records. So this is some good stuff being done here. And then notice who's going to run this initiative. Son-in-law Jared Kushner will run this. And this is a get it done kind of guy from what I can see. So anyway, cool stuff going on. Here's something else. The Trump administration's proposal to allow small business owners to set up association health plans. We talked about this last month, but I wanted to share with you what the critics are saying. Look at this. What some of them are saying is it would shift more than 3 million enrollees out of the ACA marketplace and lead to premium increases. And this is what from this source here quoted. Consequently, premiums for consumers who remain on ACA exchanges would rise by 3.5% by 2022. I don't know about you guys, but what did we say Medica's rate increase was? Right? It was a 40-some% rate increase. And then when they learned that cost share reductions weren't going to be funded by the government, they went up to 57% rate increase. I had to chuckle. I'm like, seriously? And that's kicking it out for what, 4 more years? Maybe would rise by 3.5%. Okay, I'm worried about this, right? Not really. I don't know. So, but people can blow this out of context and go, whoa, that's horrible. But is it? So we need more options. We need more choices. We need more competition. All right. So you guys remember too, in October, the executive order that said we want more competition, more choice, more access to lower healthcare options, just as we were saying. So a proposed rule that came out on February 20th, this proposes that availability of the short-term limited duration health insurance. So that's what they're calling, our old name is short-term major med, right? So if you see short-term limited duration health insurance, or sometimes I'm seeing STL or STLDI, it's crazy. So there's another acronym, but it's just that it's another short-term policy. So that's the one. So just know that this is happening. Be watching more for this. Wellmark is poised and ready to bring a short-term product back into the market. So be watching for that. Again, it'll be longer than 3 months, but not longer than a year. But that's going to be helpful, right, to many of our clients. And it will not be ACA compliant. It can't be. And so, because you're going to underwrite for it, and they probably won't cover pre-X. Not probably, they won't. This is what makes these affordable. They won't cover pre-X, and they'll probably be a lot more of like catastrophic coverage. Okay, so here's that March 23rd spending deadline that I was just referring to. This is the legislation that's been teed up by Alexander and Murray that would restore the cost-sharing payments, but also add the waiver system that would let states experiment more with Obamacare plans, and also, notice that, would spend billions of dollars in reinsurance money to subsidize extra price customers. So these 3 things, restoring cost share payments, letting the states have more innovation, with more, let them experiment, as it says there, with more different types of plans, Obamacare compliant or not, really. And then last, the reinsurance money. So these are just really big issues, and as soon as we hear them coming down, you're going to start to see more innovation. Now, what does that mean to us? More confusion. It means more learning, more studying, more understanding, more training. If you're up for it, there's going to be the opportunity here, because see, we're going to continue to see people stop selling health insurance because it's too complicated. Too many options are going to be coming back into play, and we're going to keep them all straight. What could trigger a penalty? Well, remember, the penalty is still alive in 18. Right now, the penalty is not alive in 2019. So will that change or not? Will Iowa put back a mandate and a penalty? So see, all these things can come. Lots of moving parts. Okay. Next, a bill to improve offerings under health savings accounts. I love this one. You guys know I'm a huge fan of HSAs. And so this proposed bill that's in the House would allow HSA plans, get this now, I had to read this several times to figure out what are they trying to say here. Allowing HSA plans, okay, that means the health insurance plan, to offer HSA dollars that people could use for wellness benefits. So they're talking about, a lot of this has to do with some employers being able to give HSA dollars that they use then for wellness benefits, and they don't have to necessarily have a high deductible plan, or do they? See, a lot of this needs to get fleshed out. Once this passes, they write then the guidance or the regulation. But the point is, look at this, to offer pre-deductible coverage for medication and services that maybe help manage chronic conditions. So what that says is, hey, we're going to give you benefits without having to meet your deductible first. Huh. Okay, well, that's a lot different than what we know today with our qualified high deductible health plan. So again, more coming on that, and we'll have to see. This is just speculation right now because it's just draft legislation. And then here's one of the interesting things, and I just had to throw it in here because the other side of some of this Trump administration initiatives would be the Democrats, and they're saying, let's go for a single-payer healthcare system. So a bill is being led out of the House, and there's just been a change in who's leading that. You'll see our neighbors to the north here have a representative, Keith Ellison, who's going to run with this and try to push through Medicare for All Act. So think about that one. And so if we did away with the employer space, we did away with the individual space and had Medicare for all, and you just had to buy into Medicare to get your Part A and Part B. So that's what they're talking about here. Now, we could still sell supplements, sure. But does that make sense to destroy the employer market, which is about 50% of all folks in the country are on an employer-based plan? I'm skeptical, right? But I just want you to see what the what the other side is doing when we see what we've got coming from the Trump administration. Medicare for all is an idea whose time has come. Well, we'll see. We'll see on that one. All right, so we're going to jump into employer updates, group updates. Of course, get your stuff in by March 15th. And that is, today's the 9th, so that's just next Thursday, yep. And for your April 1st, and remember that one lone ACA Aetna plan, the deadline is always the 10th of the month. So that is actually today because tomorrow's the 10th. So just know that that's today to get that one plan that Aetna has left in their ACA portfolio. Get that stuff in today to our folks, please, please, please. A couple other things going on here. A lot of stuff going on with Wellmark right now. So some of these updates. Wellmark small group verification. I talked about this a couple months back where they were going to start auditing these groups of 1 and 2. They want to make sure they're legit. So know this, that Wellmark was being pretty lenient with groups who missed the deadline to provide their proof, right? But they're saying no longer lenient. Sorry, if you don't provide the proof by the day that you're supposed to, they're going to require the group to reapply for coverage. So that could be loss in coverage, right? So you need to make sure that you're helping your folks through that if they get that letter from Wellmark, those groups of 1s or 2s. Make sure you're visiting with them and letting them know what's coming. And then the new hire waiting periods, I'm just going to share this with you, and this may be unbeknownst to you, and I kind of hope it is. But some Wellmark groups had their new hire waiting periods wiped out, and while we are trying to submit applications, we're having incorrect effective dates being applied. And so we're here, we're jumping in, we're trying to get this fixed for you, for your groups, but just know that that's been an issue and hopefully they're getting that fixed. But we just wanted to give you a heads up on that. Hopefully you haven't heard from us on it. That means it didn't impact you or your group. And now going into the Medicare market, you guys heard me talk about this over the last several months about the new Medicare card that's coming out, and it's soon, like in April, I believe. I attended one of the webinars. It was really good. I mean, some of these webinars by the government are not very good. These are really good. But I want to share with you an opportunity that they're extending, which I think is really interesting. So get this. So yes, CMS, the government is asking for our help. Yes, us agents and brokers. I think they believe us now. They believe that we can be helpful. And then notice that because of this legislation requiring CMS to remove the Social Security numbers from the cards, they're going to replace them with this really unique, no way to figure out what the number will be, which is kind of a bummer for us because sometimes we could like guess what that is before the client actually got their card to help them get going on their subs anyway. But they're going to offer webinars to address the new card design that you could actually host a webinar at a location, play the webinar for your clients. So just think about that for a minute. So you bring coffee and rolls in and you let them know that you're going to provide this seminar for them, and we dial it in, and I'm here to help you guys do this if you'd like. We'll find a place to do it. Many churches would do it probably at no charge. Maybe nursing homes would do it, and I know we got to be careful there with some of the guidelines. But again, it's an educational seminar for them to listen into these webinars, and you're hosting it for your clients. I think that sounds kind of cool. So this is a little more information on it here. I just had a couple slides, and it was just a lot of data. But the webinars would provide timely information around Medicare cost-sharing amounts, explain their portal and what they can do there. And this whole Medicare outpatient observation notice, remember how that tricks us all with that whole skilled nursing, got to have 3 nights. If you're in observation status, it doesn't count, and there's issues there. So it's kind of talking through them about that. So they're saying, hey, if you're interested in doing this, reach out to us. Here we are. These are email addresses, and if you want, do a screenshot of your computer right now if you just want to capture that. Otherwise, we'll post this. Kaylee will get this on our website later, but or just get a hold of Kaylee or me, and we can help you with this, and I'll come do it with you if you want. And here are the dates that they're doing these. So again, you might want these to say, I don't know if it's going to work for you in April or not, but I just thought that is really cool of them to engage us in this way. So again, if you call on the Medicare market and you kind of think this would be a great idea and a great way to touch your clients outside of open enrollment, to stay close to them, this is what we've got. So anyway, yeah, we just get invited, and then you'll get the link, and then like I said, I'm here to help you, so let me know. I thought that was really cool. Now we're going to go into several announcements before we wrap up and turn it over to questions, but I want to make sure you guys see this stuff. See, again, I'm trying to pour over everything I can to give you this stuff, and maybe you've heard little bits and pieces, so let me give it to you here straight. Cigna to acquire Express Scripts. Doesn't this ring a bell? Aetna to acquire CVS Caremark, right? Now, I haven't heard that one, has not gotten approved yet that I'm aware of. We'll be listening and watching, but look at this. Cigna now to acquire Express Scripts. Okay. So wanted to make sure you saw that, and that just came out, right? I think that was yesterday, right? And so that's kind of interesting. Here's another interesting piece as I was digging through, and this, you guys, has everything to do with the high cost of medications. Get this. And the Trump administration has been starting to talk about this as well. See, it says there on that bottom bullet. But check it out. United Healthcare says, we're going to stop keeping those drug discounts that they get from the drug companies, and they're going to give them to their customers. Look at what insurers contend that they already use that money from the discounts to lower premiums. They argue, of course, that the cost is the drug companies, right? But you'll notice here that the Trump administration is starting to talk about this. Now, they're targeting the Medicare market right now, but they're floating this idea of requiring those private drug plans in the Medicare space to pass on the savings that they get to consumers at the pharmacy counter. So interesting things going on here. This is not the end. I think this was one of President Trump's commitments during his election campaign to do something about those rising drug costs. So keep an eye on that one, but I thought that was super interesting, and United Healthcare is coming out saying, all right, hello, we're going to do this, and we're going to do it in wide open, and people are going to hear about it and know about it. So All right. So, hey, our Monday training webinars are back. You know this, we do this most every Monday that we can. We're going to skip next week because it's spring break here, at least for most of us, I think, in the state, but at least it is for me. And you'd lose your facilitator next Monday. So March 19th, we're going to do a demonstration. Thank you, Frank, for the idea to do an actual demonstration on Wellmark's Employer Connection. We talked about this a couple months back as well, that Wellmark's going to measure KHI on how well we get all of you to get your clients signed up for the Employer Connection portal. So what better way to do that than to show you and then give you that conviction and help them know how easy it is. Now, Wellmark's not on our call today. They will be on the 19th, but I'm going to share a little secret just between us. Look, get them to sign up by April 1st. Get the admin name, their email address, and group number, and you can really assist in this effort if you know what I mean. Wellmark is very specific to say agents are not to sign up employers. Did you hear me? Right? But I'm telling you, just between us, if you get the admin's name, their email address, and their group number, we can help in the process, may I say. The admin will watch for an email from Wellmark, and they're in, right? So they also need to set you up, and you can help with that as well, so that you get access as long as they've authorized that. Again, I don't want to get sideways with Wellmark on this. We want to make sure the administrator of that group wants you to have the access they have. Why wouldn't they? You're here to help and service them, be helpful. So just know that that's coming up on March 19th. On March 26th, we're going to do, especially for those employer groups out there, another kind of a refresh on HR AnswerLink. See, we're seeing a lot of this HR solutions, and you better be offering an HR portal, an enrollment platform, a payroll solution. Well, guys and gals, we're trying to bring this to you in not one package, though. We've got, instead of, having somebody like Ariane, that's or Focus First, Focus One Source, whatever it is, that's what they're trying to do, is bring that all together. And we're saying, look, we've got the solutions here, but you simply plug in. Somebody might be with another payroll vendor they're happy with. Fine, keep that. Let me supplement that with HR AnswerLink and benefits you can get there, or HR 360. We have both solutions. And then let's layer on this enrollment platform. So we did that demo, as you guys recall, talking about the enrollment platform. If you don't have that one, go back to our website. Ease Central is the platform. Please, this is my plug to make sure you get as many, work with our team. We don't need to get every single group on, but we want you to try it, because there is a fee for you to use this. And I'm telling you, you're going to want to do this, and the pricing is so reasonable. So we'll go back and revisit that again as we get closer to June 1st, because that's when we're going to actually begin the billing process. If you say yes, we want folks on Ease Central, then we'll begin that. So this is a free trial period now. So please get with my group team if you haven't done this yet. If you have group business that's got 5 or more lives, get with our team. And it could be 10 or more. It's again, depending on that client. Please get with our group, and they'll give you a census that you need to get completed and get in, so we can get those products loaded onto a platform, an enrollment platform. So anyway, jump on that call on the 26th with HR AnswerLink and learn about other things that are happening with employers that they expect you to bring to them these days. And then April 2nd, we're going to do something. How many of you are doing email marketing? If you're trying to build business, or you know what, just stay in touch with your people. Are you doing that? When you collect their email, are you sending a newsletter? Are you sending tidbits along the way to your folks? We're going to do a really great webinar, I think, on that day to help you understand how you can improve your practice by doing email marketing. Okay, that's what we have so far. More ideas, keep them coming in. We'll build these out on Mondays. Okay. Wellmark just pushed out in there, I think it was February 22nd, Blue Briefing. And we thought we'd bring it to your attention in case you get phone calls that this opioid management program. So here's Wellmark. Gotta love them, because they are trying to be, part of the solution here. Beginning April 1, then customers will have utilization management updated with the opioid management program. It won't cost the clients anything, but what could happen is the people they're targeting. By the way, it's really those opioids that are being dispensed for that acute or short-term pain needs. You just had your appendix out, and you're going home with some painkillers. You just had any kind of surgery, they're sending you home with painkillers. And if you guys recall this, they'd send you home with like 60 pills. Seriously? Okay, you want to get on and then off of those things as quickly as you can, right? So that's what Wellmark's going to manage to make sure doctors are not prescribing those painkillers for an acute or that kind of short-term thing that are too large quantities. They want to make sure they're smaller quantities. And then lastly, it's not going to impact those that have that chronic pain or do have that serious illness. So just know that. So if there's something gets crosswise or somebody calls you and they are one of those that have chronic pain and they're being targeted or something, you'll know what this is. You get us involved so we can get our team involved. And I don't think I announced to all of you, Tiffany Bomer is our new Wellmark account manager. Maybe I did say that last month. I can't remember. But just get it to us. We get it to Tiffany. And you'll meet Tiffany at spring training. So please come out. She does a terrific job, and we're really excited to have her as our account rep. So we'll get that and work it through the team there and help you out with it. Okay. This was just, what a goofy thing. HSA contribution update. So the 2018 HSA contribution limits, they're set, of course, every year by the federal government. And they had initially rolled this out, family contributions at $6,900. Well, they just pulled it back by $50. Now, part of me, I just wanted to go, are you serious? But then I looked at why. And they said because of the Tax Cuts and the Job Act that passed at the end of 2017, there's some kind of formula that's tied to the Consumer Price Index. And so they had to pull that back. And so they're just following the law, and that's what they had to do. So when you tell your folks, sorry, right, change, if you've already set up your contributions for the year, you're off by $50, so just modify that, right, in 2018. And the self-only coverage stays. That wasn't impacted, so it's the $34.50. Don't forget about $1,000 catch-up contribution, still allowed for those age 55 and older. All right, let's see. Here's our spring training dates. And I don't think invitations have been sent out yet, but I think they're coming very, very soon. So note these dates, and a little bit of different on the times there. We've got another event we're doing the night of the 19th, so we're going to do that in the afternoon at Prairie Meadows. And I know that one, as soon as you get your invite, don't fool around if you're interested in Des Moines, because I know that our room requirements there, we didn't get as big a room as we wanted. It might be a little tight in there, but that should be a good event. So just get registered as soon as you can to reserve your spot. And then Cedar Rapids, we'll go 9 to 12 at the Kirkwood. And then in Fort Dodge, again, we'll do our 2 sessions like we like to do, morning and afternoon. And that just accommodates, hopefully, coverage for our staff, so we never leave our office without people in it to help you. And then in Storm Lake, we're going to have to be at Buena Vista. Kings Point was not available, so we'll be back at the college there, okay? Please get that on your calendar. And then we did roll out an amazing sales opportunity, and we are going to be promoting this in training. I wanted to get this thing going like by now, by March. But what we realized is we needed to do a better job of getting the word out, that a lot of agents, you might see our emails, but you don't respond. And so we need to reach back out to you, and I think I can hit a whole bunch of you at agent training. So we're going to extend the sign-up period, if you will, through the end of April. And then it looks like we'll start classes probably that week of May 6th, 7th. I think that's the 7th might be a Monday. So it'd be the week of May 7th, probably starting on May 7th. So anyway, be watching for that. And this is, you guys, I don't know, but the pricing is so reasonable. It's like for one of you, you get 6 sessions over this 90-day period. So over 3 months, 6 sessions, amazing training. It's about 75 minutes in length, these webinars are. So they're delivered live via webinar from the comfort of your office to really help you sharpen your sales skills. And when was the last time you did that? So we'll talk about it some more at training in April, but please get a hold of Erica if you're interested. And you can go to our website on the agent portal and just click for the pricing and full details. But you guys, the price for one person, $350 to go through this 90-day training with six sessions and also a unique Facebook page that you could actually real-time tee up sales questions or what-if scenarios. You'll get some great training there. All right, and then I am so tickled to make sure all of you know that we had one of our own agents that won the Wellmark Promise Award. It went to Dean Zelli up in Waverly. And Dean, we're so proud of you. We know how hard you work. He is so, you guys, he cold calls, he door knocks, he takes the time to do that. And I know many of you want to do that and just don't take the time. You get too busy with other things, but I really encourage you, visit with Dean sometime if you run into him at training and just talk to him about how he does it. But we just want to extend our congratulations to you, Dean, and just say, way to go. We're just so proud of you. So you guys, all of you, many of you were on the chopping block there. You got chopped, right? You weren't quite high enough, but we had several KHI agents, but Dean made the cut. By the way, he was number 4. So he wasn't number 1, but they took like 10. So he was one of 10, and he's the number 4 on the small group of all Wellmark salespeople for small group sales. So just a great job there by Dean. And then, as I mentioned, I think I said to you guys, I will be out of the office next week on spring. Isn't that pretty? That just gets you thinking. I don't know, I look outside, it's kind of gloomy right now and cold. But spring is coming, and there's our hope. So I will look forward to talking to you guys at our next webinar on March 19th. And now I'll go ahead and open it up for questions. And let's see, it says here, many states already have the purple post rule. I learned about it when I had them on my property in Michigan. I did not know what they were, LOL. That's hilarious, Pam, because all of us too were sitting there going, what the heck? But when they were debating this on the Senate floor on Wednesday, one senator stood up and he goes, well, and I don't know where the color purple came from. Like red normally means stop to me, but nationally they've adopted purple, so that's the purple color for no trespassing. That's hilarious. Okay, quick question on group eligibility for Wellmark. If farmer pays his son, age 15, soon to be 16, a salary with W-2, can that qualify them for a group policy? I sure think so. I will have any of my KHI staff can chime in who works so close to that, whether Nakia, Tricia, or Allison are on the call and can unmute their lines and jump in. That would be good, but I don't see why not, because it's all around generating that W-2. So as long as he's generating a W-2 and he's working, right? What's the working age? Is it 14, Department of Labor, or is it 16? So maybe somebody can answer that for me before we go, or just type in your answer, somebody, if I don't get to you otherwise, or if you don't jump in on the call. So no more questions. I love questions, you guys. Anything else? Just comments, things you're thinking of. Is this okay? Do I give you too much information? Not enough? I know I talked super fast, but I'm just open to any feedback, you guys, to make sure I'm making this as powerful and as succinct for you guys as possible, so you can get on your day, but you've got what you need for the, till the next month. So, and other training ideas, things that you want me to do on our Monday training sessions, that 11 to 12 time slot, please let me know. And thank you. I do a great job. Well, thank you. And you love the webinars. Thank you. I'm open to feedback, criticism. I can take it, you guys. I've got thicker skin than I did when I was younger, so I can take it. All right. Well, I don't see anything else. I don't want to hold you up any longer. That's my commitment. Get you back on for your day. Everyone's, I know, so busy. So just know, again, thank you so much for your business. We had a blast at the Agent Awards event last Friday night, and I want all of you there. So literally reach out to Erica and say, I want to get on Lynn's calendar. I want to figure out how I can get to that awards event next year. Let me come visit you and figure out how we put a plan together to get you there, okay? All right, so you guys take care. And boy, I just want to reach out and hug y'all. Have a great day and a great weekend, and we'll look forward to talking to you soon. All right, take care. Bye.